Hello, everyone. Thank you so much for helping. And my name is Ransom Numa. I'm a fourth year radiography student, also a medical writer, and also a YouTuber. So, today I have an amazing guest speaker all the way from the United States of America. It's a caliber. She's a caliber. Like, I'll give her the page to introduce herself. So, Dr. Selena, could you introduce yourself to the audience?
Hi, good morning, good evening, good afternoon, depending on where you are in the world. I'm Dr. Selena Gilles. I'm an adult nurse practitioner. I've been in nursing for about 20 years. Certainly excited to be here to talk to you about my experience as a nurse practitioner, as well as an educator, a leader, and an advocate. So let's get started.
Okay. All right. So, Dr. Selena, thank you so much for introducing yourself. Like she said, she has over 20 years of experience in nursing. So, she has a lot of experience to, share. So, do well to watch this video to the end. So, Dr. Selena, we have a couple of questions for you to answer. You ready?
Okay, let's do it.
All right. So, the first question is how does your role as a nurse practitioner influence your approach to teaching and leadership? Talk us there.
Sure. I will tell you that I have been a nurse educator and a nurse practitioner for the same amount of time. Being a nurse educator was not something I intended to do. It was something that I sort of fell into. And I'm a big believer that everything happens for a reason and you ultimately end up where you're supposed to be. But I wasn't supposed to be a nurse educator. I didn't start out in that way. And so I've been a nurse practitioner for the last 15 years. When I completed my master's degree and began looking for a job as a nurse practitioner, at that time, there weren't a lot of NPs working in the hospital setting in New York City. So it was difficult for me to find a job. And I happened to run into a colleague who was working at my current institution as an adjunct and thought that it would be great for me to start out in nursing education because of my experience as a nurse in orienting new nurses and also serving as charge nurse. So I had those, or she thought I had those leadership abilities and those teaching abilities, which was great. And that's what really got me started into nursing education. So I've been a nurse educator at the same institution for the last 15 years and a nurse practitioner in various capacities over the last several years. And so what I think about nurse practitioners is that they do bring a very unique clinical perspective to teaching and leadership. I know for me, when I'm in the classroom, I love to teach by using my own personal experiences with my patients and storytelling. I think it really allows students to have a full grasp of the concept that we may be talking about. I will also say that nurse practitioners are really trained to take a holistic approach to patient care, which also translates into teaching by fostering a holistic, really student centered learning environment. And so for me, being both a practitioner and an educator really helps me to draw directly from my clinical experiences and bring those into the classroom. Of course, it's grounded in theoretical knowledge, but I'm bringing those real life scenarios to my students. And it really does help them relate to the information. And I think also enhances their learning experience. So for me, it's been a pleasure having that dual role, being that clinician, but also being that educator. I think it has helped me to build credibility and trust with my students because of that firsthand application of skills and also compassion in practice.
Amazing, amazing. Thank you so much, Dr. Selena, for talking us through on how your role as a nurse practitioner, influence your approach to teaching and leadership. And I love the fact you mentioned about storytelling, because that's synonymous to visuals as well. Because people, it's also applicable to my writings. If you use storytelling, visuals, people get to, tend to, grasp the more of the main concepts about what you're talking about. So it's
Absolutely.
amazing that you're really educating the upcoming, nurses out there, which are gonna make the healthcare system. a better place to live. So, Dr. Selena, we're wishing you the best of luck, with the team, and you guys are really doing amazing well. So that draws me to the next question for you. So, can you share us an example of a difficult situation where your servant leadership approach guided your decision making? Talk us through.
I would say that being a servant leader certainly helps me, of course, in my personal life, in my life in dealing with and educating students, and also in my life with taking care of patients as a clinician. And so, with servant leadership, you really have to, or the goal is to really prioritize the needs of others. And that's not always easy. But I think as nurses, we are nurturers, we are fixers, we are healers. And so, we innately put the needs of others over ourselves. And so whenever I'm faced with a difficult situation, I try my best to put myself in that individual's shoes to understand where they're coming from. What we don't realize is that people are walking around every day dealing with so much that we know nothing about. And so all it really takes is a little bit of a compassion, a little bit of kindness to really understand what others are going through and to be able to put yourself in those shoes. And so when I'm dealing with a difficult situation, I definitely try to make sure that I'm seeing it from that individual's side. One of the things that I think is important, especially when you're working with people and you're dealing with a challenge or a difficult situation, and you have to confront that challenge or difficult situation, one of the things that you want to make sure that you do is deal with the issue at hand. So it's not about the person and their personality or personally attacking them. It's really about focusing on that challenge or that situation. And that's something that's very important for leaders to be able to do. Servant leaders have to be supportive, right? They have to make sure that they're holding themselves accountable and holding others accountable as well. And so it's important that when you're dealing with people and you're working with a team, that people feel that you understand where they're coming from, that you care about them. It's your responsibility to make sure that the people that are around you feel valued, feel supported, feel a part of the team. And so for me as a servant leader, it's about putting the needs of the individuals that I'm working with, putting the needs of the team ahead of my own. I can apply the same thing when I'm taking care of a patient, making sure that it's patient centered. I'm putting my patients first, putting their needs above all. And that's really what servant leadership is all about.
Yeah, and that's an amazing approach. Put it like, for instance, one of the courses I did, I always say to my on my YouTube, one of the courses I did in my second year, as a radiography student, psychology and radiography talks about, you know, also nursing practice and radiography, something like that. So you talked about the patient in an hospital setting as the king. The reason why doctors, nurses, other healthcare specialties are in the hospital is for the patient.
Yes,
Without the
absolutely.
patient, without the patient, I'm not. I'm guessing that. Not even guess. It's not a guess. It's a real fact that the hospital won't even function well.
Right.
You know. Yeah, because like one of my course mates. Because we're doing a clinical rotations. So at a teaching hospital, he went to a place, a diagnostic center,
Hmm.
and have a lot of radiographic equipment modalities like CT, computed tomography, X-rays, ultrasound, and others. They don't have MRI. Just recently, the instructor to provide MRI. So always complains to when we are together like he doesn't learn much because of there are fewer patients. So that's what that draws me to the next that talks I just made a couple minutes ago, that without the patients in a hospital setting, yeah, the hospital setting won't go as far they longed for. And it's amazing that Dr. Selena has the interest of the patients, especially at heart, which is amazing, amazing strategies, amazing, you know, approaches, and I believe that the audience are really enlightened and really happy that you're doing your work amazingly well. So kudos to you, Dr. Selena. So the next question for you is, to talk us through, what skills or attributes do you believe are the most important for future physicians out there to
Mhm.
succeed in today's healthcare environment? Talk us through.
So I would say there's a few things for our healthcare professionals, whoever they might be, that are important for them to succeed in the healthcare environment. The very first thing that we talked about is that servant leadership. And that's really grounded in empathy. We want healthcare providers who have compassion, who are empathetic. When we are coming across our patients in a hospital setting or an outpatient setting, they are dealing with something that is heavy. And in some instances, it may be the worst day of their lives. And so we have to be able to approach those situations with compassion and empathy. That would be the first thing that I would say. I would also say that our future healthcare leaders need to be really good at collaborating, right? Regardless of whether you're a physician, a registered nurse, a nurse practitioner, a physical therapist, a pharmacist, a speech therapist, occupational therapist, collaboration is key. We all have our own scope of practice. We all have the same goal in mind, right? We want our patients to have good outcomes. We may have a different way of getting there, and maybe the language or the terminology we might use as a profession is different, but at the end, we are all there for the patients and we have the same goal in mind. So, collaboration is key, being able to work together to really care for your patient. I would also say that we are in a healthcare system that's ever changing, right? We're seeing more chronic disease, we're seeing more communicable diseases. We are seeing different healthcare professionals leaving the bedside, leaving the hospital. We're seeing climate change that has an impact on healthcare. We've been faced with systemic and structural issues that have led to health inequities. And so, as healthcare professionals, we have to be able to adapt with the times, really be able to assess what those challenges and barriers are as it relates to our healthcare system, and being able to work together to solve those problems. We're caring for very diverse patients. And when I say diverse, and usually when you use that term diversity, people automatically think about race and ethnicity. It's more than that. What about patients with different intellectual needs? What about patients with different physical or mental abilities? So it's really important that our healthcare providers are culturally aware and have cultural humility. Regardless of where we are, regardless of where in the world we practice, we are going to be caring for different types of patients. So that cultural humility part is extremely important. At the end of the
Right.
day, we're in a people business. And so we have to be able to be excellent communicators. We need to be able to talk to people, not just that, but talk to people at their level where they can understand, because that's a big part of our role as healthcare providers. We educate our patients, we communicate with our team members. So we have to be excellent communicators. But really, it's that empathy that is at the base of everything that we do. Being compassionate, being able to put ourselves in others' shoes, being nurturing for our patients. All of those things are important.
I think this is amazing. Thank you so much for telling us there about, the skills and attributes, you believe that are most important for future physicians out there, could be any specialty or in medicine,
Mhm.
to succeed in today's healthcare environment. And you literally talked about the main skills to acquire. You talked about, communication. I think communication is one of the major attributes you need as a physician to succeed in today's healthcare environment. Because, like Dr. Selena said, when you talk about diversity, it's not about race, religion. You're gonna meet patients that would doubt your capability as a physician,
Mm-hmm.
different intellectual patients. So
Mm-hmm.
how are you gonna adapt? How are you gonna deal with that situation if the patient? Because I don't know how it works in America. Because in Nigeria, there are patients that are wild, like they can do things that you can't imagine.
Mm-hmm.
So how are you gonna deal with that situation, that nasty situation, if you don't have all these strategies Dr. Selena, talked about? So as a physician, you watch this video, I think you should adhere to what Dr. Selena, said. She has a lot of experiences, so she's in a better place to advise us. So thank you so much, Dr. Selena, for talking us through about that. So
You're
the
welcome.
next question for you is, I've been following your journey for quite a long time, and apart from you being a nurse, you have other extracurricular activities on the table, and
Yes.
a lot of. So tell us, how do you balance your role as a nurse with your role as a teacher and all the things you do as well?
So for me, if you're following my story or if you're just meeting me today, I wear a lot of hats. And so I'm an assistant dean at my institution. So that's my administrative role. I also teach in the graduate program. I also do a lot of community work, global work, public health. I work with a lot of different organizations. So I wear so many hats. And I get this question a lot. People always ask me, when is it that you sleep? How do you do it all? And you know what? I sleep very well at night. And the reason for that is because the things that I am involved in are things that bring me joy, are things that I'm passionate about. So it doesn't feel like work. Am I busy? Absolutely. And I think a part of me likes to stay busy, but the things that I'm doing are fulfilling. I would say that I don't necessarily believe in work life balance because I don't think you're ever giving enough to the different areas in your life. I think what you should strive for is synergy. And synergy is something that I certainly strive for. So, as a clinician, as a leader, as an educator, as a community servant, the things that I'm involved in, I find synergy. And the example that I can give you is I do a lot of global work in my practice as a nurse practitioner. I've actually been on 7 medical missions. My last medical mission was in Nigeria last year. And with each of these global experiences, I also incorporate students. So I'm finding the synergy there. So I'm volunteering as a nurse practitioner, but I'm figuring out ways that I can bring students along, whether they're pre nursing students, nurse practitioner students from the United States, bringing them into that setting, or whether when we're in that setting in another country, we're able to educate those local nurses. So for me, that serves a dual purpose, right? I get to take care of patients, but I also get to teach students how to take care of patients in an immersive setting. So for me, it's really all about the synergy. How can I find the synergy? Another example that I can give you is in 2021, I ran an NP led COVID vaccination site. And it was at a time where a lot of institutions did not have their students in the clinical setting because of COVID. And I took this as an opportunity not just to serve the patients in my community, but also to educate my students. So, in developing that Brooklyn site, we were able to bring in nursing students from several different institutions. They were able to provide healthcare by giving COVID vaccinations, by providing healthcare education, by giving patients referrals for community services, like if they needed primary health care or if they needed financial resources. So here I am serving in a role as a nurse practitioner, but also serving in a role as a leader. and a nurse educator because I had a team that I was responsible to, and I had students who were also there to learn. So for me, it's really about finding synergy in the things that you are doing. But if you're an individual who is very busy and you have a lot going on with work and extracurricular activities or professional organizations that you might be working with, or you have your own business, or just other things that you might be doing outside of your full time role, I think being able to balance requires really good time management. I think that's something that I worked really hard. I nearly schedule every second of my day because I think it's important to keep myself organized and know where I'm supposed to be, when I'm supposed to be there, and also making sure that I'm adhering to any deadline. So I think time management is essential. How you do that is really what works for you. I'm a tech person, so I have my iPad and I bring it everywhere I go. It has my calendar, it has my to do list. Some people like a planner. Whatever works for you, you have to figure out how you're going to manage your time. Another big one for me is boundary setting. You have to set boundaries for yourself. You have to set boundaries for other people. You also have to set boundaries of others' expectations of you. So I have my own boundaries that I hold myself accountable for, and I hold others accountable for respecting my boundaries as well. To give you an example, the weekends are for me. That's my me time. So unless I decide that I want to volunteer, I'm not working on the weekends. Not everyone has that luxury, and that I understand. And so I think the lesson to get out of that is you have to pencil in some me time when you're looking at your schedule, when you're planning. You have to be very diligent about your me time and your self care and your rest because that's very important. We're servants, we're constantly taking care of other people. And if we're not taking care of ourselves, we're no good to anyone. So one of my boundaries is that I must get my alone time, whenever that might be during the week or the weekend. I have to have periods through my week where I don't work. So for me, it's usually the weekends because I'm involved in a lot of organizations. We may have after hour meetings during the week. And so sometimes I am working after 6 o'clock, but I pay very close attention to how often I'm doing that. And so time management and setting boundaries is something that's really going to be important to help you to balance your busy life, especially when you're working, plus also have your family, you're doing things in the community. You have to figure out what's going to keep you sane, but also keep you organized and happy.
Mm, mm, mm. Wow, Selena, that was amazing. Like, there's amazing strategies, for physicians out there and future physicians out there, to find a means to, balance their roles with other, interests. Because, yeah, I was in a meeting a few hours ago and we were talking about med students as well have other interests as well.
Mhm.
It mustn't be medicine to the core. For instance, me now, I'm studying radiography. Uh, my other interest is I'm a very good writer. I'm a medical writer, reading a lot of articles, publications, a
Mhm.
lot of contents, So, and also I have a YouTube, you know.
So
These,
you're balancing a lot of things.
yeah. So these two are interests, right?
Hmm.
And needs prioritization of those interests as well. Giving time at what's needed. If it's time to study, is to study. If it's time to do content, is to do the content. If it's
Yeah.
time to, write, it's time to write. Like if we
Hmm.
talked about, time management.
Hmm.
Having a calendar where you put your to-do list and how I love the fact you mentioned about boundaries. And I believe that the audience are really enlightened about how the will balance their current roles or their current study
Hmm.
works with other interests as well. So thank you so much, Dr. Selena, for talking us through about that. So we have two more questions for you to
Sure.
round up the session. So the next question for you is, hmm, this is a bit intriguing because I know you're already. So what ideas do you think or do you use to bring care up to date and incorporate into your teachings as well? What do you have to say about that?
One of the things that I always stress to my students, because I feel like students who are pursuing healthcare, they have this ideal of, I want to be perfect. I want to be the smartest. I want to know everything. And I have to tell them, you're never going to know everything about everything. I don't know everything about everything, and I've been practicing for 20 years. And that's because we're dealing with an ever-changing healthcare system. It is not possible to know everything about everything. But what's important is that you're always learning and you're willing to learn. And so the ways that you stay up to date with the most recent clinical practices, I think making sure that you're up to date with research. Are you reading articles? Are you looking at webinars? Are you attending workshops? Are you going to conferences? These are the ways that you are really going to stay up to date on what's happening in our healthcare system. So make sure that you are partaking in those professional development activities so that you can stay current in your practice. So you're constantly learning. The other thing I would say is, as a clinician and an educator, it's also important for me to also still practice, right? That is how I stay current. I'm working in the outpatient setting. You may have some individuals who may be working in the inpatient setting, but you have fully immersed yourself into that clinical setting. You're actively taking care of patients. What better way to stay up to date with what's happening in our healthcare system? And so you want to make sure that you are doing your part as a clinician, because that's going to keep you as the best educator you possibly can be. So again, it's really finding that synergy. I love taking care of my patients. I love my students. I don't think I could ever do one without the other. And I'm happy that I'm able to bring those two worlds together, find their synergy, and really prepare those equity minded healthcare professionals who I know are going to go out there and dismantle healthcare inequities and really be a force for our healthcare system. But you always have to learn. We're always learning.
Hmm, hmm. You heard what Dr. Selena said. I'm still a student, and I don't, I can't redress, you know, more about this on how to bring care up to date because I'm still in the process of being trained, as a radiographer. So I'm not in a very good position to talk about how you can bring up care today and incorporate into your teachings as well. So Dr. Selena is the best position to talk to me about that because she's a testament. She has a lot of you know I've been following your journey for a while now. You're amazing. I love the fact that you also find time to go for conferences and networking events.
It's important.
Amazing, amazing. Because if I'm doing the kind of work you do, I wouldn't even have time to think about events and stuff. But it's amazing that you find times to you know go for all those things to also network with people. Amazing. So I think future physicians and physicians out there, looking at to ideas, more ideas to use to bring care into up to date in your practice. And also, if you're an educator out there, these are also amazing ideas Dr. Selena dropped that can help you to incorporate in your teachings as well.
Hmm.
So, Dr. Selena, thank you so much for telling us through. We have the last question for you.
Okay.
So, how do you think the role of nurses will change in the next decade? What do you have to say on that?
I will say that the role of nursing is ever changing. The image of a nurse 100 years ago, 50 years ago, 20 years ago, even 5 years ago is not what it is today. And I think that's a really good thing. Nurses have expanded roles. Before, when you thought about the image of a nurse, you thought about the nurse in the white uniform with the white cap at the bedside giving medications. And yes, that's one of the roles that we have, but nurses are so much more. Nurses are leaders, right? Nurses are administrators. Nurses are educators, whether in the community, in an academic institution, or in a hospital. Nurses are researchers. Nurses are scientists. Nurses are entrepreneurs. Nurses are doing so many things now that they haven't done before, and I know that is going to continue to change. I'm really excited about the role of the advanced practice nurse. We have almost 400,000 nurse practitioners in the United States, and I'm happy to see that you are seeing the role of the advanced practice nurse in other countries. That's something that is very rewarding for me as a nurse practitioner. Actually, this week is Nurse Practitioner Week, and so that's why I want to highlight all of my fellow NPs. The role of the advanced practice nurse is literally skyrocketing. Advanced practice nurses are becoming much more autonomous, particularly in underserved areas, and they're playing key roles in healthcare, like in telehealth, remote monitoring that we're seeing now with the use of technology both inside and outside of the hospital, even the way that we educate patients. The truth is, more than 50% of primary care providers are nurse practitioners or PAs. We have a lot of physicians who are moving out of primary care, and we are approaching a physician shortage. And so nurse practitioners are really instrumental in filling that gap and being able to take care of our patients. The part that I would like to add to that is our patients' needs are becoming a lot more complex. Like I said earlier, we're dealing with more chronic disease and sequela from that. We're dealing with more communicable disease. We're seeing how climate change impacts health. And there are a whole lot of health inequities that we still have to dismantle. And so I think nurse practitioners as clinicians, nurse practitioners are as leaders are really going to be instrumental in leading those interdisciplinary teams that are going to solve those problems. The role of the advanced practice nurse is ever expanding, and they are great leaders and advocates for their patients, their profession, and really what we're seeing in the healthcare system with nurses, we are really driving improvements in healthcare, not just quality, but also accessibility. So I think the future for nursing, the future for advanced practicing nurses is bright. And there's so much more that we can do to change our healthcare system and also our profession.
Amazing, amazing, amazing. Wow, can't thank you enough, Dr. Selena. Thank you so much for your time, because you all know already she's a very, very busy person. And for her to take the time to talk us through about those intriguing questions, that means that shows that you need to watch this video to the end so you can grasp what she dropped, because she dropped an amazing nuggets that could help physicians and future physicians out there, to up the games in healthcare, in
Mhm,
their care for patients, and also other interests, like you want interested in educating, interested
mhm.
in leadership, and all that. Amazing. And so, if you wanted to connect with Dr. Selena on LinkedIn and other social media platforms, it'll be added on the YouTube description below. So make sure to connect with her. And if you're a nurse out there looking for mentors, I think Dr. Selena is more than a mentor for you. So she's
Happy to.
really willing to help you, willing to educate you the more to up your games as well, and other physicians as well. So if you love this content, do it to like, share, and comment. And make sure if you have questions, you can comment, or you can reach out to Selena as well. She's willing to help you as well. So thank you, everyone. Thank you, Selena. That was me.
Thank you for having me.